Hello, and welcome to the GRACE podcast series. My name is Denise Brock, and I am the Operations Director for the Global Resource for Advancing Cancer Education, or GRACE. In this podcast series, we interview patients, advocates, and healthcare professionals to provide the most updated information for our community and to highlight important issues facing those dealing with a cancer diagnosis. We hope you find this information valuable. For questions or comments, please visit us at cancergrace.org.
So just a brief moment on the treatments in development. Here are some future approaches that we're excited about in treating mesothelioma. The first thing to address is targeted therapy, which is a big part of treatment in lung cancer, but has not been as big a part in treatment of mesothelioma. Here on the right side, you can see some of the changes, the genetic changes that are common to mesothelioma: BAP1, CDKN2A, NF2, ASSS1. These are things that we are attempting to target, but nothing has really made its way into standard of care yet. So still things we're working on. One other area that is in active development as well is cellular therapy. So this is CAR T therapy that you may have heard about in leukemia or lymphoma. For mesothelioma and other cancers, it's targeting a protein called mesothelin. This treatment is fairly labor intensive and takes some time. It requires a blood sample from the patient, processing in a lab, and then giving that blood back to the patient. So we're eagerly awaiting additional data from this and hoping that this could be something available for patients in the future. Another area of treatment for mesothelioma and additional improvements we can make is improving surgery. So we know that getting out as much as you can during surgery leads to better outcomes. So trying to have better ways of detecting residual tumors, such as through advanced techniques of intraoperative imaging, is one area of interest. Photodynamic therapy is a type of treatment that happens in the OR during surgery, as well as intrathoracic chemotherapy, where they actually put chemotherapy in during the surgery. And then certainly there's a role for radiation around surgery in many cases. Also, we're looking at novel immunotherapy and chemotherapy agents, in particular antibody drug conjugates, which are essentially taking something like immunotherapy that's an antibody and attaching a chemotherapy-like drug to it. So a similar idea to combining chemotherapy and immunotherapy. Also targeting blood vessels, we have various agents that do that, and novel ways of delivering treatment. So not just through an IV in the arm, but maybe delivering it into the pleural space where the disease is. So again, back to Dr. Nowak's slide showing that where we started in 2019, we had a very linear path of options, and now here we are in 2020, or in this case, it was 2021 when she made this slide. And we're making a lot of more complex decisions for patients with mesothelioma. First, as she outlines here, really the treatment for epithelioid and non-epithelioid mesothelioma is different, at least in the first line. And then we have a lot of other options after that first treatment.
Thank you again for joining us. This podcast was made possible by the generosity of sponsorship from our friends at Lilly and Exelixis. Please like and follow us on Facebook and Twitter. Send us feedback, share your story, donate, and visit us for more information at cancergrace.org. Thank you for listening.